Welcome everyone to Strand 3, Policy Milestones for Early Education, a GPS for Strategic Partnerships. I'm Jana Martella. I'm a Senior Advisor at the Education Development Center and on the TA leadership team at the PDG B5 Center. In a moment, I'll introduce you to my colleague on the screen, Ellen Freedy, but first I'd like to tie our strand to yesterday's plenary and a few of the remarks from Linda, who stressed that in the early childhood work, communication is vital and that we should push through to the enduring partnerships and learn from our colleagues. Easy lessons and hard lessons learned are better when they're shared. And that's just what we're going to be doing in all of today's sessions, including session 6, which is about powerful communication strategies that support partnerships. Yesterday, we also heard from Brooke, who urged us to make connection, to build relationships and trust, to take the time to learn about our partners as individuals. She stressed that people use different language and different metrics, but to find the intersections in those. We're definitely going to do that in session 1, structures and processes that support enduring intra and interagency partnerships. Session 2, inside-outside success, talking about inside agency, outside agency, the work of systems building within and without. And session 4 will ask participants to examine who have they not invited to the table. Frank also emphasized connection, and he reminded us that we live in a society designed to divide us by religion, politics, program, race, gender, you name it. So we should start with an aim to build unity and connections. Strand 5 will do that around equitable and adaptive partnerships, building authentic relationships with those who live and kind of experience the system. Strand 3, from the Early Learning Challenge to PDG B5, optimizing partnerships, will take us from the Early Learning Challenge into the PDG grant system. So now I'm going to try to share my screen. Be patient with me here. And I'm going to pull up a little timeline that we have created for all of you. It brings us to the timeline with key milestones in early childhood systems building. Our main point here in our time together is the idea that early childhood systems building is a long journey in the same direction. I sat in on Strand 2 earlier and heard from Neil. I was really happy that he started 100 years ago with Olmsted kind of developing the system of Central Park in Manhattan. We're not going back that far, and in fact, we've built this timeline with key touch points for our field, and we know that it's not comprehensive. We're bound to have left off something that is very important, and though we are not Bill and Ted, this is our excellent adventure. I've known Ellen for 20 years, so we're not starting in 1954. That was just before I came along, but we thought that starting with Brown v. Board of Education was an important component of equity, because that is a marker in the timeline of early childhood education that definitely revolved around equity. So we have built the system for you, and also want to remind you that PDG is not the starting point. In fact, we're not done yet. It's not the starting point of the federal partnership with states and with neighborhoods. And it's not the starting point of mixed delivery and comprehensive services. These, in fact, were a component part of the Great Society programs that started with Head Start, but also included the Elementary and Secondary Education Act, which began in the mid-60s. So that brings us up to the Abbott Preschool Program. And I'll also kind of move around the timeline a little bit back and forth. But this brings us to the 2 decades where I have known Ellen Freedy. who's also on the screen. And this has been the beginning of our journey together. It actually begins a little bit later. But I wanted to point out the Abbott Preschool Program because I first met Ellen as co-director at NEAR, but in the beginning of this millennium, Ellen was on the tails of working on Abbott and was working on the expansion of New Jersey's preschool effort through the Department of Education. I also wanted to remind folks that kind of the whole child approach is also not new. And we have all of the neuroscience, all of the health anchors, economic sciences and developmental sciences in Neurons to Neighborhoods. And this report is still available from the National Academies of Science. And I urge you guys to go there. But I want to hand off to Ellen and let her tell her story. I'm going to take us, Ellen, first to the Pew Charitable Trusts, and then I'll kind of move back and forth on the timeline as you tell your story in New Jersey and nationally.
Thanks, Jana. And I'm going to try in 10 minutes to talk about 20 years of a national movement and the intersection, and that national movement and the intersection with some things that happened in one state. So obviously it's going to be very cursory. I guess think about it as we're speeding down the highway using our GPS toward our destination. I also want to go back a little historically to say the field of early childhood, as Jana mentioned, has always been one of strategic partnerships. We know that children don't thrive on education alone. There are many different things that they need. And I think that the field, as embodied in the National Association for the Education of Young Children, has always believed that education happens where children are. And I think my own career reflects this. I was an original Head Start summer volunteer. I also came along right after the Board of Education. I think Jana and I may be very close in age. I then went on to work in employer-sponsored childcare, church-sponsored childcare, Head Start, and public school. And in my early work in high scope, creating one of the first training of teacher trainers project in Los Angeles County. The Los Angeles County Head Start took place in public school classrooms, Head Start classrooms, small nonprofits. And I think the reason I bring this up is just to say, as I began with, these different kinds of strategic partners and mixed delivery has always been part of who we are. We've also always been 0 to 8. Those of us who came up in the field of early childhood have always seen early childhood as that expanse of really prenatal to third grade. Sometimes we stretch a little bit further than third grade. But in the policy work recently, the fulcrum of that work has really been the preschool years. But that's not just because it's in the middle of the 0 to 8 span. It's partly it's strategic. For one thing, access to kindergarten through third grade during that time became universal. It wasn't universal for kindergarten in the beginning. But 3- and 4-year-olds were more likely to be in out-of-home care. So that was another reason that we focused on that, because the care was not funded adequately to be high quality for the most part. And we had research to show that if we invested in improving the education during those years, we could actually improve children's lifetime trajectories. So while today I'm going to be talking mostly about pre-K policy, I just wanted to be sure that that you understood we were embodying the full spectrum of early childhood care and education. And then when we think about strategic partnerships, we need to include that. So back to the beginning of this 20-year period, in New Jersey, nationally, in 2001 and 2002, which is the first time this data were collected, 14% of 4-year-olds were being served in state-funded pre-K and 3% of 3-year-olds. Fast forward to the last time we collected data, 2018-2019, that number has doubled to just over 1/3 of 4-year-olds and not quite 6% of 3-year-olds. This is obviously not distributed equally across the state. In New Jersey, where we have universal pre-K for 3- and 4-year-olds in 30 of our 600 school districts, which represents about 25% of the population. We increased from that Abbott pre-K decision, which was a court-ordered pre-K for those 30 school districts. We increased from just under 6,000 before the court order to well over 40,000 5 years later, which was a 600% increase. So you can see how it varies state by state. And of course, we have some states that have universal pre-K and other states that have no pre-K. So that same research on the benefits of pre-K is what convinced the New Jersey Supreme Court to order pre-K as an educational remedy. And the Abbott v. Burke case is actually a longstanding case that's been going on for close to 50 years to equalize funding across school districts. And in most, so I'm sorry, I lost it. In most of the states, that same research led legislatures to make decisions to fund preschool. And state agency leads were typically solidly rooted in the NAYC view of early childhood education as being across auspices. So to give a couple of examples, in the early 80s in Massachusetts, there was a grant-funded program to increase quality and access to pre-K. And the state required localities to get together, to have child care, Head Start, and public school together create an application and decide who among them would be the lead, and then apply for a competitive grant. New York had a similar pilot going on at that time. West Virginia, interestingly, their legislature required that 50% of the children be served in child care centers and Head Start programs, and they created a governance structure where the state pre-K administrator, the child care administrator, the preschool special education 619 coordinator, and the Head Start collab director form a steering team that oversees implementation of the pre-K program. And that same structure is mirrored in each of the localities. So you can see that, again, this idea of strategic partnerships is really baked into the idea of public pre-K. So Jana mentioned the Pew Charitable Trust. So I'm going to jump back now to 2002 when the Pew Charitable Trust decided to invest a large amount of money in a 10-year initiative, which actually founded my organization, the National Institute for Early Education Research, and also Pre-K Now. So they purposely funded a research organization to do research to inform policy, and an advocacy organization to fund advocacy in the states. We then created the Near State of Pre-K yearbook, which those data that I gave earlier about access to pre-K represented. But at the same time, the yearbook also combined the National Academy reports that Jana mentioned and other research bases to set up some guardrails for us. So those guardrails, these minimum quality policy standards derived from the research, helped us know where we were heading. What is the goalpost for our GPS, and then what we need though is partners to help us figure out how to get there. And so our partners help us in a sense, if you will, design our AAA triptych for this journey that we're on. In New Jersey and elsewhere, depending on policy agenda set by various governors and incentivized by federal initiatives, the partnerships have waxed and waned, and sometimes some of us were just too busy and some partnerships went by the wayside. Other times just the new policy that we had to implement made us put our heads down and focus. But mixed delivery has always been necessitated within and across agency partnerships, which we'll be talking about in one of the sessions today. In my state, in New Jersey, I know that Tanya and Lenore are going to be speaking about a long-standing new interagency collaboration, which was not in existence when we started, even though we had regular conversations. I think those partnerships with advocates that started with the Pew Initiative is a very important one for those of us in state agencies to think about. In New Jersey, we had one already. We had a coalition that helped inform the court about the decision they were making. We never had state agencies involved in that because it was the state that was being sued. So once that court case got settled, we all got together and worked together, and that was an important strategic partnership for me when I was at the state. The question about who's at the table, I think, has been a difficult one. Certainly in New Jersey, P3 was always part of it, but not as central as we would have liked. Mixed delivery was always part of it, but we had very limited interaction with programs for infants and toddlers because we were so head down getting that pre-K program started. The one that troubled me the most, the one voice that wasn't at the table, was the state administrators who dealt with housing. At the time, McKinney-Vento did not include pre-K, and so the child's right to the universal program ended when the families got relocated outside of the school district. And that always troubled me considerably, and I was very happy when that ruling changed. But I still think that there is a lot to be said for including that group in your partnership. And then I think the various federal grants along the way have really made a big difference, and especially the one we're in right now, the PDG B5, really has required us to add more leads to the table so that we can have more people at the table. I think that this pandemic crisis has also highlighted the importance of timely and transparent communications. It was very important to me, and I would recommend to you and state agencies to control your message, work with your partners, make sure they know what messages are coming out. But if you don't control the message, someone else does. And so, but the one thing I was never any good at was graphically appealing messages, so there's another partnership you might want to cultivate is with somebody who's good at that. And Jana, I'll turn it back to you.
Thank you, Ellen. I want to kind of head back and just point out that there have been some cross-agency partnerships that were supported by philanthropy. The BUILD initiative, I know folks on the webinar with us today are probably pretty familiar with that. It is on the timeline as well. You may be less familiar with Getting Ready, which was an indicators project sponsored by the Annie E. Casey Foundation, a 17-state partnership, and they worked on multiple dimensions of readiness that included, and you guys may know the formula, ready schools, ready communities, ready families equals ready children. So, you know, I think that the main point that we are trying to present is that this is a long journey in the same direction, and that partnerships is an essential component, and that they have to be nourished, and you have to use that GPS to get there to make sure that everyone is at the appropriate table. We're not there yet. It's 2020. We have a new journey that we're setting on toward the vision, certainly. And we want to give you guys an opportunity in your concurrent session to think about these different partnerships. And I'm going to stop sharing now and offer the screen back to our tech crew. Ellen, I think we're pretty much out of time. You see here the screen of the concurrent sessions that are coming up. We want to give you guys a few minutes break, so we'll let you know in the next slide that you'll go back to your dashboard for your concurrent sessions. And we're going to give you to the hour. I think this may have been in your previous strands. You may have gone directly to your concurrent breakouts or your concurrent sessions. We want to give you a little bit of a break here, and you can start in whatever time zone you are on right at 4 o'clock. And I also want to ask Ellen if you, so we can give everybody 5 minutes. I don't know, Ellen, if you have any last minute words of advice that you want to pipe in here, or if you want to head directly to our concurrent sessions. I will remind, depending on the size of your concurrent sessions, I will give a shout out to all of our facilitators and state sparks that should the conversation be really brewing and you not want to break up into breakouts, that will be fine as long as the conversations get going. Anything else, Ellen?
No, thanks.
Okay, so on the hour, you can return to your concurrent session based on your dashboard and your registration. Thank you, Ellen.